All right, everyone, we are going to do a little mock quiz here. Let's see how you all do. All right, so let's take a look. Let's see how you do in answering some of these questions. So if the question here said, what type of tissue is this? Be specific. You may scramble, right? But let's say it said, what type of epithelium is this? What would you say? Give you a second, you'd look at it, you'd say it's flat, irregular shaped, simple squamous epithelium. Say the whole thing, simple squamous epithelium. Not just simple squamous epithelium. What type of tissue? Okay, you have to look at it, find the lumen, look at the shape of the cell, how many layers, right? Those are the questions. What type of epithelium? Simple cuboidal epithelium. Name the epithelium. You look at it. We'll do number 4 first. What's the shape? Column shaped. They're all in line. You have some cilia here. You could, I would accept for this simple columnar epithelium, or you could say, well, some of these nuclei are at different, I would even take pseudo-stratified ciliated columnar epithelium. And then number 3, what is 3? That's a goblet cell. Name the epithelium. Threw a little hint here, up here, I even left esophagus. So if you want to think of what's happening there biomechanically, it needs protection. So we know it's epithelium. You got multiple layers here where number 5 is. Stratified squamous epithelium. Vaginal area. What type of epithelium? Again, multiple layers, flat, stratified, squamous epithelium. What about here? Close-up view. Stratified squamous epithelium. What type of connective tissue? I said connective tissue, I didn't say epithelium. So this is adipose or adipocytes. What type of tissue is this? Be specific. So it is connective tissue, but what type? You would say bone, or you could say compact bone, or the osteon. So these have all different possibilities. Now, what type of tissue is this? This is connective tissue. And you know, these are, let's see, number 11. What is number 11? This is a red blood cell or an erythrocyte. And what is this? This is a neutrophil, right? 1, 2, 3 heads to the nuclei. It's granular, that's a neutrophil. So this is a neutrophil, which is a granular white blood cell. This is an RBC, red blood cell. All right, now we're looking at the microscope. So I want to know what is number 12 and what is number 13. So number 12, these are objective lenses. And 13, this larger one, is the coarse adjustment knob. If it was this one, it would be the fine adjustment knob. Okay, let's see, number 14. What is 14? We're looking at the cell. This is the what? Golgi complex or Golgi apparatus. What is 15? Mitochondria. What is 16? Nucleolus, not nucleus, nucleolus. Okay, 17. Let's say it says, what is its function? Not what is the name, what is its function? Then you could say carbohydrate metabolism or lipid metabolism. What is it? It's the smooth endoplasmic reticulum. What about 18? 18 is the rough endoplasmic reticulum. If I asked you what's the function of 15, instead of naming 15, you would say ATP production or energy production. If I asked you what is this, the yellow structure at the bottom, you would say lysosome. If I asked you what is the gray, you would say peroxisome. If I asked you what is the function of the gray, instead of the name, right? Don't always jump. On the exam, I may say, what is the function? Name the structure. Don't just jump always to structure. Sometimes it's structure, sometimes it's function. Then this would be detoxification of harmful substances. Okay, what is number 19? Here's 19. What is this? Concentric lamellae. What is this? What are the red lines? Here. Canaliculi. What is this? Where the black arrows are at the bottom, the hollowed out space. Lacunae. Okay, let's look at number 20. What is this right here? Number 20. Erector pili. What's 21? Right here, what's 21? Sudiferous gland, which is the oil gland. What's 22? I'm sorry, my bad. Let me go back. Hold on. Sebaceous gland, your oil gland, sebaceous gland, not sudiferous, sebaceous. What is 22? I gave it away. Sudiferous, which is your sweat gland. 23 at the bottom. What is 23? Pacinian corpuscle. Pacinian corpuscle. That's your deep pressure sensor. What is this over here on the top left? This number 1 on the top left. This layer. Epidermis. What about number 2, Roman numeral 2 on the left? What is this layer? Dermis. What is Roman numeral number 3? Subcutaneous. What if I pointed to number 2 on the right? What is 2 on the right? It is the epidermis, but what layer? Remember, Cher loves getting skin Botox. Stratum corneum. And if we talk about number 6 and 7, that would be the stratum germinativum or the basal lamina. I would accept both. Okay? Right, mitosis. What is number 24? And what is 25? This would be metaphase, number 24, and then 25. Anaphase. That would be anaphase. Okay. All right, and that would be it. Let me stop the share. Let's stop the recording. So that was a good practice quiz, give you a little bit of taste. I mean, there is a lot more. You want to make sure you know the regions and the quadrants and the planes. You want to know anatomical reference points, the regions of the body, anatomical position, superior, inferior, medial, lateral, proximal, distal, cephalad, caudal, contralateral, ipsilateral, superficial, deep, cervical, lumbar, carpal, tarsal, mental, buccal, orbital, otic, all those terms, right? Make sure you review them for the exam, of course.